Hola a toda la comunidad de la Sociedad Mexicana de Urología. Estamos aquí en otra versión de UroTalks con el doctor Daniel Oliveira, que nos acompaña desde Portugal. Y vamos a empezar con nuestra entrevista. Doctor, it's so great to have you here. We got to share a little bit of training people now in the EBLOS exam. So, like we talked a little bit earlier, I would like to start this interview with you sharing your experience as an EAU professor and UREP professor. How about your teaching experience for our younger residents and urologists?
Thank you very much for having me and for having this interview. Are very nice. So
Thank
really
you.
nice to be here. So I've started to become part of the teaching group at UREP Tutors. Let's say that can also, it's like a group that will also give teaching in other contests, other congresses, other courses. So actually that's part of why I'm here, to help with the EBLUS exams and exercises. And the idea is to do this training. You know, the European Association of Urology, in its section of the European School of Urology, has a program which is called SIZE, so Standardization in Surgical Education.
Okay.
The idea is that we have exercises in all the fields of urology, let's say, even in non-technical skills.
Yeah.
And there are different levels of this. So EBLUS is like the basics, let's call it this way, of laparoscopy.
Because like we saw, I mean, basics, it's just a name because they're not easy at all, right?
It's like sometimes you have exams that you pass, you study for the exam. Here, it's something that you have to study for this exam, practice for this exam, but actually it will give you tools for your practice. So it's basic because it's hard to become more basic than this. Laparoscopy is tough.
Yeah.
So the thing is, even the basic skills make you practice, and if it makes you practice to pass the exam, you will be much better surgeon after. And the idea of European School of Urology is that you first practice in models, so when you go to the patient after, then you are skilled. And it's not that the first time you do a knot, it's in the patient.
Exactly.
That's the idea.
And this idea of standardization, I mean, it's not new at all, but it has proven to be a very good tool to hone the skills of every young urologist or even older urologists who are interested in the field of laparoscopy or any other kind of surgical technique that needs training, right?
Yes.
So, and how about this hands-on training is what you're all about in Europe, right?
Yes, Europe, I don't know if everybody knows about this. Europe is like a program for last year residents around Europe, but also around the world. And the idea is that if this program is possible to be widespread and be done in much more places in every continent, that would be interesting. And that's the idea of European School of Urology, to try to improve the program and give more tools to the residents all around the world. Of course, now it's only still possible to do it at Europe, but trying to get more and more people from abroad, from other continents. And the idea is to spread this kind of concept and this kind of teaching to other places, because we have seen what it has done. It's not only about laparoscopy. Here,
exactly.
We've done mainly laparoscopy, but the programs that are more advanced now is the robotics that started parallel. Now it's getting into this size program, but also the endoscopic part, like for TURP, TURBT, and also for stone surgery. So you also have different steps for ureteroscopy, for PCNL, for just cystoscopy. So you have a lot of different steps, and the idea is that you have at least 3 steps before doing a fellowship, something like that.
Yeah, and this philosophy of learning everything in the simulators before entering a real patient, right? Always looking for the safety of the patient.
Yes.
And this, I mean, I'm insisting on this standardization, but do you publish this kind of training for every hospital in Europe? Do you have that kind of, or is that an objective to have them all do the same kind of training?
Of course, it's not possible to do it, to say it's done now, but that's the objective. Actually, in many places you see, I don't know if it's happening here, but from what we have talked before with you and some other colleagues, I can understand it's also happening that sometimes residents don't get the same opportunities according to the place where they are.
Exactly.
And with more and more technology coming out, it's less likely that they get the chances, because before everybody was doing open surgery.
Yeah,
period.
and that's easy.
Even though in urology we have endoscopic surgery for a long time, but even that, at the beginning it was hard to learn how to do endoscopic surgery because there were no cameras. And with all this evolving technology, if a resident doesn't get the chance to practice on simulators, when they get the chance to do it in a patient, they should know what to do before, because it's the only practice they will have before going. So the idea is that we can make it more even for people independently where they come from. So the idea is to make it more equal.
Exactly, because that's what we see. I mean, not only in Europe, here in Mexico especially, that's a very different kind of opportunity depending on where you've done your residency. Right? We have people that went to a huge hospital or to a very specialized hospital, and we go out with a very different set of skills. Yeah. And there is no standardization at all. Yes. So that should be an objective, right? And to be a little bit more about you, I have questions about you. If you would tell me, this is my favorite surgery in urology, which would it be?
So it's hard to say this is my favorite surgery.
Try to.
I do like to perform surgery. I'm more specialized nowadays in oncological urology. So let's say I do a lot of radical prostatectomies. I do a lot of radical cystectomies. I'll also do radical nephrectomies and partial nephrectomies. And because this is the field I'm more keen to. Of course, I still do general urology. In Portugal, it's not yet easy to be over-specialized.
Yeah, of course.
In my country, so you still have to do many stuff, which I actually also like. But at some point, I really like to treat these kind of patients, oncological ones, when I hope I can make a difference. So I also do focal therapy in prostate cancer, which I think it's a field that it has a lot to grow, at least in Europe. I don't know how it is in here, but I think we are still a bit afraid of that step of the treatment. But for some patients, it might be the best. But what my focus is to treat the patient and not give him the treatment I want them to do.
Of course,
Adapt it to the patient and to the disease, of course. Tailor the treatment, I think it's very important. Nowadays, we are all talking about precision medicine and theranostics and whatever. So I think we should really adapt for the person we have to do the correct treatment for them.
Yeah, which is what we should all try to do, right? And talking about, I mean, it's funny for me because here in Mexico, over-specialized urologists, maybe I could tell you there's 5 or 6, because we all have to do general urology, even though we like some field more than others. But most of us, we're like in Portugal, we do everything, just a little bit of everything, and maybe we do a little bit more of what we like. But like you said, just tailor-made treatments, and that's what we should all do, right?
I agree.
Perfect. So it's been a pleasure, Doctor. It's been a real pleasure to have you here. We hope you enjoy Guadalajara, and we'll see each other later. Right?
Yes, the pleasure was mine, and thank you very much again for inviting me. It was really nice to be here.
Thank you very much.
Thank you.